We just start. I didn't know, I always vote yes on medical marijuana, but I never looked it up, ever, I don't know anything about it.
I don't know a whole lot, I've just seen videos, you know, that float on Facebook or anything like that, and I did watch one all the way through one time. It was a man that had Parkinson's, you know, like he was visibly shaking, and then offered it to him, and it stopped.
I think I watched it.
Interesting.
If medical marijuana is used, I think it should be closely monitored. I could see where it could benefit somebody, but it also could be a gateway drug onto something else. And it does impair a person. They would need to use it with caution as far as driving or operating machinery or such. So I see both sides of the marijuana thing.
Yeah, and I've seen stuff where people will like go to the doctor and be like, I have anxiety, but it's just to get the card so that they can.
Some people do abuse that.
Yeah.
Right.
So can you just like separate the CBD from the THC?
There's different, yeah. They have them labeled as THC and CBD.
That makes sense.
Mm.
That makes a lot of sense.
I do see a lot more of the places to get it.
Yeah, my mom used to be getting CBD gummies.
So is that the same, like, it's the same that you can go to a gas station now and they have them?
Yeah, that's CBD.
So I thought it could only be sold at those, what are they called, like the dispensaries?
Yeah.
And I see it at like the infused like lotions and stuff. I wonder if
Yeah, I've
those
seen-
actually like help, or if it's just.
There's a restaurant in Memphis that serves infused foods.
Does it have to be, like, ingested or inhaled, or can it go in through this?
It can, yeah.
I wonder if that would be good for your eczema. Medical marijuana for your eczema. I'll try it, maybe I'll try.
I've had to use it in the past for like period cramps, when they got really, really bad.
Yeah.
Or like, I pulled a muscle in my back a couple years ago, and the only thing that the doctor would give me was muscle relaxers, and they would make me sleepy. But I needed to function, and I got a prescription, and it helped. But at the same time, it was like also it was in a process of being codependent on it, so I just stopped it completely because that wasn't.
Yeah.
So if you're going somewhere, you need to take a drug test, will that show up?
Mm.
And so if
Can you
you
just
show
show
that
the
it's
card?
the
I'm not what it's saying, but with the prescription.
You have to show
I
your
think
card
medical,
and.
medical marijuana would show, I don't think CBD shows up, because you can buy CBD cream at the pharmacy. I don't think they're gonna sell it to you and not tell you, hey, this is gonna cause you to fail a drug test if you use it.
Well, but they're not advertising
muscle
poppy
relaxer spray.
seeds like that either.
That's what I was thinking. And they don't tell you that poppy seeds will show up on a drug test, but it will.
Like our commercial driver training program here, we drug test every student, and if marijuana shows up, it's an automatic out, whether you have a marijuana card or not, because it's not federally, the federal government does not approve it, whether the states do or not, the federal government does. It doesn't matter whether you have a prescription, you're out.
I think it's the same with like the nursing programs too, don't they?
I think so.
Yeah, the flea market, they have a little CBD muscle relaxer spray for $1. It actually works pretty good.
Really? Which flea market?
Which flea markets she seen? That's a good
It doesn't
question.
have any, you can't get high.
But would it
I
help
just
with
have
pain
ranks.
or seizures or anxiety?
It works really, really good. It still
Would
smells
the
like the
topical
lidocaine.
work for anxiety?
I like lidocaine too.
That's an interesting question. She said, would the topical work for anxiety or what else?
Pain,
I could see orange for pain, but I don't know. Maybe they put like some lavender in there. Help with the anxiety.
That's what I'm saying though, I think we're talking about two separate things. Medical marijuana requires you to like get a card, to get a prescription, to get it. CBD
And you can only
is
get that at
over
the
the counter
dispensary, right?
stuff that you can get.
Yeah, that's true.
Okay.
It helps with pain management. So I think you're kind of thinking of two different things when you're thinking the difference between medical marijuana and like a CBD cream.
Yeah.
So I have a question. What's in place if someone who does not use gets addicted and goes on this whole spiral that would not have happened had not this initial, and because of it being needed versus recreation? Is there something in place? Because I'm just wondering, does it pull somebody down a trail that they never desired?
It does.
So is there anything in place? Because it's almost like, who's responsible? Who's responsible for the help? Who's responsible for whatever the consequences are as a result of that?
There's, well, the doctors, they keep, close, they keep the close,
Like monitor.
yes, they monitor the patients closely, and if it starts to get out of hand, then they take the prescription down a little bit, and if that doesn't help, then rehabilitation purposes,
So how soon,
rehabilitation programs.
how soon could can I use this word? How soon could a virgin, you get where I'm coming from, become addicted? See, these are the things that just makes me wonder. I have a whole different spiel on it, but I'm trying to work within the confines of this conversation. The responsibilities, this person is now, has been introduced to something by professionals who they know that it has the great possibility. I guess any medication can have that possibility, but I'm just specifically talking about this. Who's responsible and who's responsible for what happens to an individual that this is their first time and it has a drastic effect. It's supposed to be quote unquote to help, and it's a drastic effect because that was perfect terrible. I'm so sorry.
I understand where you're
Or
going.
is it,
I'm not
but
push.
to your point, I mean, who's responsible if a doctor prescribes opioids and the person gets addicted?
Absolutely. So
I don't know that a lot of people have like sued the doctors over providing medication and then they get addicted to it. Now, there may be cases, and I'd like to see if anybody has, like, has anybody sued a doctor facility or pharmacy or anything for prescribing, pharmacy's not gonna prescribe you, but I wonder if anybody has ever done that, because who is responsible if the person gets addicted?
I mean, you
I
don't
Is
have,
it the person or?
Yeah, I was gonna ask, whenever it's prescribed, it's you, the patient requesting it, or, cause the doctors just don't outright say, here, this is the only thing I can think of that'll work.
It could go either way, really.
Because do they suggest that because of what they see as a pain that's, and I'm being very honest, I don't push for it at all, to be very honest with you. But I'm participating because this is information that's valuable to know, both sides. But I just have to make my statement up front because it's recorded. I don't push for it,
Right.
but I do have questions
In some doctor's offices, they have, flyers on the walls that say, if you would like a medical card, you know, just ask about it.
Kinda going off of what you said, I don't, like, I've not done research, obviously, I don't know that people have sued, but I do know personally, my OBGYN was banned from the hospital and not able to deliver my third baby because he had written too many opiate prescriptions to people. So, there are cases that come out of it, I don't know if he was sued.
It's
or
very
if just
highly
the medical
monitored
board,
now.
yeah.
He wrote too many for like people that were seeking, or
I guess I don't know. That was all the information I really gave me. And he's banned from the hospital. You gotta find a new OB a week before having your baby. Yeah.
can I ask a completely unrelated question to the moralities of what we're talking about? So medical marijuana would just be like inhale marijuana, right?
I would think it would be edible. Wouldn't it?
Okay. Never, that's something, I forgot that it was.
Edibles and
I was
things,
I was gonna say, are there like options for people that can't inhale stuff, cause like I have asthma, I can barely hold air in my lungs. I cannot hold smoke in my lungs or anything, to be able to.
I don't have an answer to that question, I don't know.
Edibles,
That's interesting, though.
yeah, I completely forgot about.
Shouldn't have been driving.
It's a good question.
I don't think I myself would choose to take it for anything, but I do understand why it may be beneficial for some, and why it could be a big issue.
yeah, you know, a lot of people have the addictive trait in their family and it just gets passed down.
My family's on.
So is there something in place that if somebody has already had addiction to something, they obviously cannot be prescribed it, you know?
Just like, with the opioids,
Do they usually ask, like, before prescribing those, if there's a family history and?
And then sometimes you just may never know, because there could be a history, there could not be a history,
Right.
but there's an individual.
You could have started the history.
That's true.
So it's so many variables.
you know, so you never know if somebody's actually telling the truth or not.
Right.
If they just want it,
Or just how it will affect the person.
When I got diagnosed with type 1 diabetes, I was in my 20s, and my mom said, well, ain't nobody but like your cousin has it or something. And she said since then, you know, she's found where like there's probably 6 to 8 people further down the line in the family who were diagnosed with it, but it's not something the families ever look at until something comes up and they're thinking, oh, I wonder if somebody had this, so it's the same with addiction, where, you know, may not be known, but somebody may eventually say, oh yeah, well, Uncle Fred down at wherever was addicted to this, and, oh yeah, and so was this, and it's just not something that families talk about and discuss and look into until there's a problem or an issue.
Right. And then some families don't even wanna classify stuff like that as addiction and be like, well, yeah, we have in the family, be like, he just really likes to drink.
oh, nothing
He
wrong
drinks
with
every
you.
night, it's fine.
Right,
It's fine, it's normal.
that's just him.
It's
Some
not an
people
excess.
associate it with, what's wrong with it?
Like
Like,
drug use.
well, if the person that drinks all night, well, if they're not beating their family because of it, it's, you know, it's not, you know, some people will put it off and make it something different.
Like if they can still function or function.
See, I think what people may miss is it's not all the time someone else that you hurt. It actually can hurt them, and I have a very prime story of individual who didn't intentionally adding something that could really take you off into left field or the wrong right field, because people may love it, may love what it tastes like, may love what it seems to make them feel like at the moment. But then over time, it has the possibility, as with everything, because you can abuse even the best of something, like, too much, guilty. But what I'm saying, you have to make sure you keep yourself in mind as well, because it does things to the organs, and over a period of time, even with this, it could potentially affect your thinking. It could affect your decision making in certain things. As with so many things that's possible, I'm just kind of referencing this. And I'm being very careful because I'm trying to give input versus trying to actually say where I may stand with it. So I'm trying to be real careful and respectful at the same time. But I think you also have to look at, am I messing up this? You know, even though I heard people say, oh, it makes you feel real good. Only thing happens, you're very hungry or whatever. You know,
I wonder if there's any maximums in like, what they give for medical marijuana? Cause I'm sure they start
Like a
out like a
dosage?
very low dosage, but is there a maximum where they say, once you hit this, we're not giving you any more? Because, you know, with any drug, it's kinda like, well, this helps for a while, and then, oh, it's not helping as much anymore, so I need more, I need a bigger dose.
Short-term
And then that helps for a little bit, but then it's not helping anymore. So where's the cap at to determine, okay, well, we've done this and we tried it,
and so it could.
to where like they do with
Sorry.
medication,
Go ahead.
you know, what they do with pills. You know, obviously there's milligram dosages for opioids, and they say, well, once you get to this, if this isn't working, then we're gonna try something different. Or if there's something like that in place with under a medical marijuana type thing, I don't know.
Another thought that, to piggyback off that question, is if the doctors say, I'm not gonna give you anymore, so then it stirs up, how else can I get it? And so that opens up a whole new avenue of, I'm going to get it, cause now I need it. You're not gonna give it to me like I'm supposed to have it, I'm gonna find it another way. And so that opens up, and so with a subject like this, I like to think about all of the pros and cons about it. You know, personally, I stay away from it all. A lot of people have their reasons for support or whatever. I respect that. But the point of it is, you have to also look past. It may appear to help at the moment, but it I just unlock a door to a room that I just don't want to be in. And once I get in the room, now the window disappears, the key disappears, the knob disappears, and I'm stuck. You see what I'm saying? So I try to think about it a lot, you know, beyond just, I know these people have said it helps, people have said it makes them feel good, people have said it works towards certain, and I get it, but it's a lot to it.
With the medical cards, they actually have a cap. Like, you can only get so much every so often.